This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
8:35 on Monday, and that means Mon Health Talk here on WAJR. Thanks for joining us. I'm Kyle Wiggs. We've got two guests this morning. Tricia Julian is an Oncology Nurse Navigator. And Tricia, good morning. Thanks for coming on.
Good morning, Kyle. Thank you for having us.
We also have Jeffrey Sandy, who's with Healthworks. Now, Jeffrey's been on our airwaves many times, but just on a different day with the Healthworks show. Jeffrey, good morning. Thanks for coming on.
Good morning. My pleasure to be here.
All right. So let's first talk about this partnership between Mon Health and Healthworks. How did it come to pass, the two entities working together? Which one of you would like to start with that one?
Jeff, do you want to take that?
Sure, I can do that. So Healthworks is proud to be a partner with Mon Health, and we, through that process, have developed a relationship through our Revital Cancer Rehab Program with the Cancer Center at Mon Health. It's a great opportunity not only to bring physical therapy to patients with cancer, but then also to collaborate on projects like this, the thing that we're going to talk about today, our PB&J series.
Right, PB&J. First of all, take one step back, Jeffrey, and remind people what the Revital Cancer Program is at Healthworks and how that can help people who are dealing with some of these issues.
Yeah, certainly. So Revital is a national rehab program offered exclusively in our area by Healthworks Rehab and Fitness. It involves a network of specially trained therapists who receive additional training in oncology rehabilitation, and we focus on many of the impairments that can be unique to cancer and its treatments. So things like cancer-related fatigue, chemotherapy-induced peripheral neuropathy, so like numbness, tingling, and pain in the hands and feet, weakness, balance issues, among many other things.
Yeah, extremely valuable service you provide there at Healthworks. And there's also, Jeff, I know part of the service that Healthworks provides is to help people prepare for cancer surgery, correct?
Yeah, absolutely. So surgery is a big part of what we do, especially particularly patients, you can imagine, that are facing a mastectomy procedure if they've been diagnosed with breast cancer. So getting them in before their surgery to provide education, but also work on things like range of motion, stretching, strength, helps them to better be prepared for surgery and recover quicker from surgery.
All right, so prehab for surgery and then obviously post-surgery physical therapy at Healthworks. Okay, Tricia, let's talk about, I think Jeff mentioned it, PB&J. It means a little something different, Persevering, Brave, and Joyful series. What's that all about?
Yes. So this series, came to be when a group of us came together and thought that we needed some type of a support group for our patients out in the community. And so we all came together and thought up these ideas of these different sessions. We decided to try 3 sessions, one monthly for 3 months, and that worked out just beautifully. We did that last fall. We did one on emotional wellness, and the second month we did one on nourish and nurture, which pertained to healthy eating. And then the third one we did in conjunction with Healthworks, and we did energize and exercise and taught people how to exercise in a safe way during a cancer diagnosis. And so those were very, very successful sessions, and our patients who attended those actually asked us for another set of sessions, and so we were, needless to say, delighted about that. So we came up with our next 3 set of sessions.
Okay. So when will the next group of sessions begin?
The next group of sessions will begin on March 18th, which is a little more than a week from today. It's on a Tuesday evening. The sessions are from 6 to 8 p.m. They'll be held here at the hospital, and the only thing that we ask is that you register for the sessions, and patients can register for any of those sessions, for one or for all three, by calling my office at 304-285-2622.
Okay, 304-285-2622. How many did you have participate the first time around?
We had 7 in one session, 11 in another session, and 9 in the third session. Now, those numbers sound small, but for a support group, those are phenomenal numbers. And the ladies got to form friendships, and there was just so much camaraderie within those sessions. Jeff can tell you people formed friendships, and we provided journals for them, and a lot of ladies wrote down who they were sitting next to and what they did at each session. It was just a wonderful experience for everyone.
So, Jeffrey, what's Healthworks' role in the PB&J Cancer Support Group?
So initially, we've just been very involved in collaborating, helping Tricia where she needs us, trying to provide ideas. As she mentioned during the first group of sessions, we provided the location and the materials for one of the sessions on exercising. And then this coming one, actually, our business development manager, Tara, is going to do a chair yoga and meditation session at our first one on March 18th. So we're really excited about that. And we're also just providing materials. So Tricia does a great job. She creates like a little gift bag for all the participants. So we've provided some materials for that. But really, we're just here to be a collaborative partner and just help enhance the sessions as much as possible.
Tricia, the first sessions, as you say, were a great success, and obviously you're getting the word out here via this radio program. So you look to grow those sessions, right? You've got the hospital facility, so you can accommodate more people, right?
We really can. Our administration has been so supportive with anything that we've wanted to do with our patients. And one very important point that I want to make is that these sessions are not just for our patients. These sessions are for any patient out in the community who wants to attend. We really welcome any cancer patient. The transition between being treated and into the survivorship phase can often be a very frustrating one and a very anxiety-filled phase of their cancer journey. So we are welcoming everyone to come to these sessions.
Okay, so it's not just Mon Health patients or not just Healthworks patients. Anyone out there who is listening can get involved in these sessions, and you can call Tricia at 304-285-2622. Will the sessions have the same topics, Tricia, or will they be different? Will they be a little bit more refined?
We've purposely made the topics different for each session, always allowing for interaction between the patients. What we typically do is there are meals provided with these sessions, and so we usually do the meal first to allow patients to interact with each other and get more comfortable. And after that, we will have this session. Now, as Jeff said, our first session is chair yoga with meditation. We're really excited about that because the fatigue can really overcome patients when they're doing treatment. Chair yoga will be a wonderful way for them to be able to continue to exercise without exerting a lot of energy. And the meditation will really help with anxiety. The second session is going to be a book club. There is a book titled Between Two Kingdoms, and it's about a young cancer patient who goes from active treatment to her survivorship and how she navigates that transition. And then our third one that we're really excited about is a healthy cooking session, and we're actually going to have a chef to show patients how to do healthier cooking. And those of us in our team, we always try to practice what we preach, and we're all going to bring healthy side dishes for the meal. So we're really looking forward to that one. So it's a really widely varied set of topics that we're going to touch on.
Yes, that sounds outstanding. Sounds like a lot of fun. And Jeffrey, the first session is the one I would imagine Healthworks directly involved in. What are your plans for that one?
Yeah, so as we mentioned, we're really going to focus in on some chair yoga and meditation. Those can be great tools, especially for someone that's just getting back to being active again. So we know oftentimes people can feel overwhelmed or a little intimidated with exercise or kind of getting back to their normal routines after they've had cancer or extensive cancer treatments. So yoga can be a great way to slowly get back into that. And there's a lot of things like some breathing techniques and things that are involved in yoga that really trigger your parasympathetic nervous system, which really helps the body to relax, kind of relieve some of that anxiety and tension that people may feel. And I also think this series overall gives people, it's a great empowering opportunity for people, because people so often when they have cancer or they're undergoing all these treatments, they can feel really things are out of their control. They don't really feel empowered. And I think this has been a great way to get kind of people back on track and get them kind of being themselves again.
That's a great point, Jeff. Yes.
Now, we all know cancer's brutal. It takes a lot out of people physically and mentally. So, Jeffrey, what would you say to someone who's, again, it's easy for us to say to someone who's been through a surgery or through something that has affected their body and their mental state. How important is physical exercise? How important is mental health to those who have been through this?
I think as much as I focus on the physical aspect, I think all of those things are equally important. I think getting back to some level of physical fitness, the research shows us that that's going to help actually decrease fatigue, improve physical function, improve surgical healing, all of those things that we want to see to help people get back to their former quality of life. But also such an important part of that is the mental, emotional aspect as well. And also nutrition. We know that nutrition plays a significant role. All of these things really work together to create a healthier person, and we know that that really impacts, number one, your risk for developing cancer to begin with, but also now the research is really showing that some of these techniques of being a little bit healthier can actually decrease your risk for recurrence or the cancer coming back, which, that's a pretty big deal. We don't want people getting cancer a second time.
Yeah, absolutely. That's all part of it. Physical and mental health and nutrition all helps kind of fight that off for it coming back. Tricia, if someone out there is listening and they're a little bit hesitant, what would you say to encourage them to pick up the phone and call you and register for this and get involved?
So we had a couple of people who were a little hesitant the first couple of sessions. They were a little hesitant to share their experiences, and we encourage them to share as much or as little as they want to. But by the end of the first session, the people had made friends. They were enthusiastic about coming back. So I would tell those people who are hesitant, come and try the first session. It's a free meal. You'll get to meet some very nice people, and then you can decide whether you want to come back to the second or third sessions. But I can almost guarantee you that they will end up coming back for the second and third sessions.
Yeah, with the first round, did you increase? Did you decrease? Did you stay the same from session 1 through session 3?
No, we increased because there were people who attended who ended up bringing friends of theirs who had cancer. They were so excited about the program that they ended up bringing friends of theirs. And that's what we're seeing this time, too. I had somebody call me and say, hey, I want to come, but I want to bring my friend, too. Is that okay? And so that connection is helping us to get more attendees.
Yeah, absolutely. Okay. Okay, so we are talking about the PB&J. PB&J Cancer Support Group. And again, the PB&J Cancer Support Group, Persevering, Brave, and Joyful series. We are with Tricia Julian, Oncology Nurse Navigator with Mon Health, and also Jeffrey Sandy with Healthworks, the Director of Specialty Programs. We need to take a quick break. We'll do that now, and we'll come back and resume the conversation on Mon Health Talk right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing for this Monday. We are with Tricia Julian, Oncology Nurse Navigator with Mon Health, and also Jeffrey Sandy with Healthworks, Director of Specialty Programs. We're talking about a fairly new group, the Persevering, Brave, and Joyful series, Cancer Support Group, and Mon Health and Healthworks working in conjunction with this, and anyone in the community can get involved. It's not just for Mon Health patients or for Healthworks patients. Anybody in the community can get involved. 304-285-2622. And Jeffrey, I'm going to return to you here for a minute. What does Healthworks have to offer for those that are facing a major procedure with cancer, or those who are trying to recover both physically and mentally from perhaps a cancer diagnosis or even surgery?
Yeah, so our goal at Healthworks and with the Revital Cancer Rehab Program is to really reach as many patients as possible. You know, we would like to see a world where physical therapy is part of every patient with cancer's plan of what we call plan of care, or their appointments that they see. So we really believe strongly that we are positioned well to really help maintain that quality of life that can sometimes kind of get away from people when they're dealing with all of these things. And we're really excited. So we have now spread our Revital program from Uniontown, Pennsylvania, here in Morgantown, Fairmont, West Virginia, and also Buchanan, West Virginia. And along with that, we are offering pelvic health in all those areas as well, which works very, very closely with cancer rehab. So we're really excited just to bring that to as many people as possible. Obviously, in our Morgantown Center, that's kind of our main location. We oftentimes employ aquatic therapy. We have our certified hand therapists, which help with neuropathy in the hands, getting people doing, more fine motor things like being able to button a button or write or do those things again. So we really try to take that comprehensive approach. We also, here in our Morgantown location, now have outpatient nutrition services, which, as we're mentioning on this call, can be so important for patients with cancer. So we're really excited to bring such comprehensive care to people and just try to help as many people as possible.
And Tricia, you deal with people every single day that are going through this. So what kind of a difference does a program like this make for those who can take advantage of it and get the camaraderie, get some information they need in terms of diet, in terms of getting physically back to where they need to be? How does something like this help a cancer patient?
Well, first of all, I just want to say I have to give a shout-out to Jeff and to Tara, who do a remarkable job of running the Revital program. They could have stayed in their own lane and done just the Revital program, but they have not done that. They have reached out and partnered with us to do a lot of different things, this program being one of them. So they've just been amazing to deal with. I have seen the unbelievable results of them working with people for peripheral neuropathy, for dealing with fatigue, the prehab that they do before surgeries. We see on a first-hand basis the difference that makes in patients' recovery. And this program, in terms of what it does for patients, we see patients a lot of times who feel very isolated. They feel that other people don't understand what they're going through with their illness. Coming to a program like this, you are with like-minded people. You're with professionals who know what you're going through, not directly, but we all live through our patients vicariously, and we see what they go through. So these programs are vital not only for the skills that we teach, but for the camaraderie and for the emotional boost that it can give to patients.
Okay, we've got about a minute left, so Tricia, take that to recap what we've talked about, the dates, what the programs will be, and how people can get involved.
Yeah, we also want to thank our foundation. They've provided meals, our books, and our yoga mats, so they've been very supportive. The dates for the sessions are March 18th. Got to look at my calendar here. April 29th.
Okay.
And then May gosh, I should have, May 20th.
Okay, so about once a month.
Right, once a month. They can call my office at 304-285-2622 to register, and we ask that you do register because we need to plan for food and plan for equipment that we have available for patients.
Sure. 304-285-2622. And again, it is Persevering, Brave, and Joyful series. There's a physical fitness aspect. There's a mental health aspect. There's a nutritional aspect. There's a camaraderie aspect. And this time there's a book. There's a book club.
There is, and they will receive a copy of the book to take home and read.
All right. Outstanding. Well, this is tremendous. We appreciate you all doing this for our community, and good luck with it. Tricia Julian, Oncology Nurse Navigator, and Jeffrey Sandy, Specialty Programs Director at Healthworks. Thanks for your time.
Thank you so much, Kyle.
All right.
Thanks, Kyle. Our pleasure.
All right. That is Mon Health Talk for this Monday on WAJR.